morning when I come to the dental office is I have to set up a patient's tray. So if the patient Lady Gaga was to come in for a composite and restorative exam, I would have to look at the blue bin, which is labeled composites and restorative, and this whole office is basically color-coded based on the exams that the dentist performs. So what I would need is to place the necessary equipment, which is shown in this box, onto the tray and get each of one of these, which is basically a necessity for each of the individual trays for each patient. And I would write the patient's name on a post-it. Stick it onto the tray. So when the patient comes in, it would be easier for the dentist to reach in and grab the necessary tray and place into the operatory room. So a day of looking in the back is when the doctor is done treating the patient, I take the trays with the used instruments to sterilize. So what I do first is I throw away all the gauze and clombing wheels that they use on the patient, and all the sharp materials basically go into the sharp biohazard bin, which is separate from the trash. And then I take the used instrument and put it inside the container, which goes inside this ultrasonic machine for rinsing to get rid of the blood that the patients may have had in their mouth. And this process usually takes about 10 minutes. And then I take the instrument out after it's done, pour it here, wipe it a little dry first, just a little slight tap. And I take one of these pouches and I put the instrument inside. So after I place the instruments inside the package and tightly seal it, I'm going to place it inside the sterilization machine. So what I do is open it up and place the package face down, put it back in, and I select a cycle. So I'm going to do this. And what it does is it wraps up the package and it sterilizes all the germs that were used during the patient in the exams. And when the sterilization is complete, you can tell from the package that the word defend actually turns black, and that's actually a good sign because that meant the sterilization was complete.
Go to pour the model. First, you take 3 scoops of silicone powder. After you got the 2 scoops, gently put water in the bowl. Make sure you don't put too much. Mix it until it's firm. Firm yellow stone powder. Place some on the tray, and I put it on this vibrator so it levels it out, and then it vibrates out with a bubble, like this. Then, yeah, I'm gonna add some more. Not enough. Let it vibrate. Now I'm gonna add a base to it. After when it's set, it should look like this. Or this.
The process that Desmond did comes out with the result of a teeth impression that looks like this.
Right now I'm going to show you how to make a teeth impression. The first thing you do is you take 2 scoops of alginate powder. Make sure you level it out first before you put it in so it doesn't have any extra left over. Place in a bowl. After that, take it to the sink. You can mix put a little bit of cold water. Make sure you don't put too much or else when you run. You're gonna keep doing this until it's firm. I put this impression tray in your mouth to make it happen anymore. First, I stretch the cheek with the index finger. Second, I place it in slowly. and quickly, but nothing hurt the patient. Third, I press down like this, and then I push it down slowly, and then wait for 1 minute and 30 seconds. Now I've been 1 minute and 30 seconds. So now I'm going to take it out. First, I keep my thumb and I grab onto this, push it out slowly.